There are several signs and symptoms of a stroke that people should be aware of. A lot of these are things that people already know about. Things like weakness of one side of your body, facial weakness, slurred speech, difficulty getting words out, and balance issues are the main things that we see with strokes. However, there are also some symptoms that are a little different that you also need to come to the ER about, and those are things like dizziness, visual changes, or even confusion. If you feel like you're having signs of a stroke, the most important thing to do is call 911. Ambulance can pick you up, and they can actually do things in the ambulance that you can't do if you drive to the emergency room. They can start an IV, they can do an NIH stroke scale, and also other things that you might need that can't be done. If you don't want to call an ambulance though, you do need to go to the emergency room immediately. Time is very important with strokes because we have the availability of thrombolytics, or what the lay people think is like clot-busting drugs. And if you present within 4.5 hours of onset of the symptoms, then those are an option that you might be able to receive. If you present to the emergency department with a stroke, you'll be brought straight back to a room. NIH stroke scale will be performed on you, which is a way that we measure how bad the stroke is. It's a stroke scale that's used throughout the country. If your stroke is bad enough, you'll have a CAT scan of your head, and also we do a CT angiogram of your head now that shows the arteries to your brain better. And if your stroke's not quite as bad, then you would more than likely just have the CT of your head at that point. We also do labs, and we do EKGs, and we hook you on the monitor, and do other things in the ER as well. We do have a capability here of we have teleneurology here, which is a neurologist that's at a different location that sees you through a monitor and can perform a neurologic exam and make recommendations to us as to whether or not thrombolytics are useful or would be indicated for your stroke. At that point, you may be transferred to a higher level of care, or we may admit you to our hospital. But if you are having a stroke, you'll either be admitted or transferred to a higher level of care. To prevent strokes, you need to take care of several issues, just like you would want to prevent heart disease or diabetes or other major problems that we have here that are worse in Mississippi. One of the main things that you could do is exercise and watch your diet. If you do have hypertension, you need to take your blood pressure medicine like you're supposed to and make sure that your blood pressure is controlled. If you run out of your blood pressure medicine, don't run out of your blood pressure medicine. But if you do run out of your blood pressure medicine, you need to get it refilled as quickly as possible. There is a free clinic here in New Albany that meets once a month, that if you don't have insurance or don't have an option for primary care, they are available to help you with things like blood pressure or diabetes medicines. Also, if you can't get in there, then the ER would be an option for something like that. It's that important that you don't run out of your medicine. If you do have diabetes, you need to make sure your glucoses are under control and you take your medicines for that. You need to be aware of what your cholesterol is and take your medicines for that as well, and try to keep that at a good level. And another thing that's really important would be annual checkups with your provider, and that would also be an important thing to keep that up.